Concerns are growing about the monkeypox outbreak after 3 children in Georgia tested positive, including one who was attending school. Across the country, now at least 13 children have tested positive in 9 states. I want to bring in emergency physician and ABC News medical contributor Dr. Darian Sutton for more on this. Dr. Sutton, what's your guidance as the school year is about to begin? What do parents need to look out for?
Well, first and foremost, I want to remind parents that thankfully these cases still remain limited, and the risk of transmission within the classroom is still low, as monkeypox most often requires that direct, prolonged skin-to-skin contact. But a lot of the mitigation efforts that we learned during the pandemic can cross over into protecting us against monkeypox. For parents, I would advise them to contact their schools, understand what provisions have been put in place to help decrease the risk of spread in terms of cleaning high-touch surfaces. Are there reminders for children not to interact with prolonged touch, and also reminders about the possibility of needed isolation. Parents should look up what monkeypox looks like, and if their child has any new rash with any new flu-like symptoms, they should keep them home until they confirm that they are not contagious and contact their pediatrician.
Now, there's currently one drug to treat monkeypox. How effective is it? How does it work? And do we have enough of it?
Great question. So teapots is the antiviral medication that has been used and provisionally used to treat monkeypox. It originally was used or given the FDA approval to treat smallpox. Now, as you know, Diane, smallpox has been fully eradicated, but teapots has been stored in stockpiles in the event that smallpox were to reemerge, or the possibility of smallpox being used as a biological agent. Now, given that, teapots still has very limited data, and the majority of the data is limited just to animals. So it becomes a little bit of a difficult stance that federal officials are trying to grapple with, understanding what is the risk-benefit analysis of treating teapots for patients who have monkeypox. Overall, the effectiveness is really limited in human studies, but many are arguing, why don't we give teapots to those who are in need of it and continue to do what we call post-market analysis? But another difficult part and a barrier to access is that teapots has not been given the EUA approval, which doesn't allow it to be stored in pharmacies. So this makes it really difficult to get teapots to those who need it.
Oof, that's a lot of hoops to jump through. Meanwhile, the number of monkeypox cases, we see it rising pretty much every day. What's the risk associated with daily activities, and what can people do to protect themselves?
This is a common question from my patients, my friends, and my family. I've worked with the medical unit here within ABC to help understand what are the individual risks of the activities that we do, and we separated them based on risk level, with the understanding that the most common route of transmission of monkeypox is through that prolonged skin-to-skin contact. So risky events include things like prolonged skin-to-skin contact, intimate contact between one another. Less risky things include things like living with someone. Although the risk is there, you decrease your risk by decreasing the possibility of sharing food with them or sharing blankets or clothing. And then things that are less risky, things like face-to-face contact, shaking hands with someone, those are not as risky. But again, you always want to walk around with an understanding of the risk that is around you. And so the best way that I think is to do that is to always have your equipment and your supplies available. Bringing your mask for crowded rooms, bringing your hand sanitizer for those when you're interacting with others, and making sure that you avoid skin-to-skin contact with people you don't know.
All right, Dr. Darian Sutton, great advice as always. Thank you.
Of course.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.